so here's something I know a lot of people struggle with, that pain in the lower back. We've got Dr. Jim Blanton here from Blanton Chiropractic here to talk about some treatment options that don't require surgery. So just to start off with, how many people, how common of a problem is this that you see?
You know, not surprisingly, there are so many people with back pain and neck pain in the United States. Like at any given time, you can have 60 to 80% of the people are having some sort of back pain or neck pain. So it's very common, very frequent.
Okay, and I know you brought in one of your props here that shows something that a lot of people suffer with and may not even realize what's going on.
Yeah, we're looking at you have the vertebra here, and in between the vertebra is the soft part, which is the disc. And what can happen is, over time or from different injuries, the disc will get compressed, and when they get compressed, then it will cause them to either bulge or herniate out, and then when they start pressing against nerves or the spinal cord, then it's causing a real problem. Or some people, it can be called stenosis, because those foramen or those holes are getting narrowed down. So what we're looking at is, we always say gravity never stops. So we've got to get pressure off of those nerves somehow. So what we're looking for are people that are wanting to avoid back surgery, or they're not a candidate for back surgery.
Okay. So what can be done to treat low back pain that's non-surgical?
Well, there's new guidelines in the last couple of years from the American Academy of Physicians, which is from the medical doctor group, that are recommended. The first thing, because of the opioid crisis that we've had, is the first thing people should do is a conservative option. And so that can be chiropractic care, it can be massage, it can be exercise, like the YMCA would be great, right? It can be anything, physical therapy, anything besides surgery first.
So try some of those options.
Or pain pills first. We want a conservative option first. So, and then there's even another study out that if you see a chiropractor first, that you have a 53% less chance of having a back surgery.
Really?
So, yes.
Well, talk about what is spinal decompression. Is that the treatment that you do?
We do this, and so in addition to our chiropractic care that we do, we have special tables at our office. We can do this on not only the lower back, but also the neck, because some people have neck pain and headaches. But we are able to.
Table right there?
That's one of our tables. So we're able to strap in. Let's say for the low back, we strap in the upper body, and then we have a computer that is attached to that strap. And so what it does on the disc, it pulls on the disc, so it's taking pressure off, and then the computer lets off. So what it's trying to do is pump the disc to get bad toxins, bad fluids out, get good fluids in there, and get more space. And we always say millimeters, not inches. We're not trying to pull it apart, but if we can just get a millimeter or two more back in there, then it's going to change your life. And so then we use other techniques with that. We have lasers and different lights and different other devices that we are using to get circulation back into those areas as well.
So how many visits does it typically take of being on that table?
It really depends. It can go anywhere from 12 to 36 visits. It just depends on how bad it is and how long you've had it and how much compression is on the disc.
But you can get some results after so many treatments.
For the people that qualify for the program, and you do have to qualify, we're doing an exam and really checking it out, we are getting some just miraculous, great results with this. That
is great. Well, I know that you're offering a $49 gift card. Tell us what this covers. How can this help people?
What that covers is, it covers a full exam, including x-rays and a full orthopedic test, so we can see if we can help or not. And so people that haven't got results from other means, they should give us a chance. And you know, like we've always said before here, procrastination is the thief of health. Don't put it off. You know, life is too short to suffer all the time when you don't have to. So the ladies at their office right now, call the number that we have on the screen and give us a call, and they can get you in and get you scheduled for an exam and see if we can help you.
Right, okay, and we've got all the information on the screen right now. There's that phone number, also your website. If people want to, do a little research and find out more about it, all of it's right there.
Perfect.
Yeah, well, Dr. Blanton, thanks so much for stopping by and sharing this with us.
Thank you. I appreciate it as always.